Dental detoxification. Amalgams are a problem. Amalgams have been used to fill teeth for a long period of time in this culture. The amalgams contain mercury. Mercury and other metals such as silver and tin and copper, but they contain about 50% mercury. Mercury is a heavy metal. It's a heavy metal that has the potential to have toxic effect in our body. I think an important aspect to improving our health is to pay attention to what we put in our body. And when we put amalgams into our mouth, can create a very problematic experience. To the point that I would definitely make that suggestion to everybody that don't put amalgams in your mouth. Now, what happens if you do have amalgams? Well, I think everybody should have their amalgams removed, but some people really, it is very essential to their health that that's now a burden for them. And to remove that burden is very important. Dental detoxification is about helping your body, giving your body the ability to clear itself of potential heavy metal toxicity, specifically in the form of mercury. So I think it's a good hygiene perspective to say, get all the amalgams out of your mouth, but I do think for some people it's much more important. They're much more susceptible to things in their environment, that getting the amalgams removed is important to do right away. There's many dentists in the Twin Cities who will do this kind of thing and remove amalgams and put in, composite fillings as a replacement. The issue with removing those amalgams is that's the first step. Take out the source, remove the burden. But what's not always considered is the idea is when you remove that burden, you release a lot of mercury into the system. And releasing that mercury in the system can often create some toxic effects immediately after the procedure, after removing the amalgams. So there's simple things that people can do to help detoxify from having the amalgams removed from their body, from their teeth. So there's simple things and there's complex things. So if we really wanted to put it into maybe 4 steps, if we want to talk about it. So the first step is obviously remove the amalgams, remove the burden. First step. That's a dentist, a biologic dentist, somebody that's more knowledgeable about that can be able to address that. The second step is to help increase the mobilization or the removal from mercury from the system. That may be doing some things that work in the gastrointestinal tract to help bind it and help carry it out. Constipation is a serious concern if you're having amalgams removed. We want to make sure that the bowels are moving and these routes of elimination are open. So other routes of elimination include the urine, the breath, the skin. So sweating can be really beneficial in helping detoxify mercury. So those are simple first steps, or maybe the second step. The third step then is doing some strategies that actually help improve your liver's ability to detoxify. The liver is the organ that's behind the scenes doing all the cleanup work. It metabolizes fat, protein, carbohydrates. It's dealing with both endogenous and exogenous toxins, toxins from outside the body and toxins from inside the body, hormones and heavy metals or anything that's in your body. So part of that strategy is finding some things or working on some strategies to improve that liver's ability to detoxify. That's let's say, a little bit more aggressive than opening the routes of elimination. Then the fourth step, which is something that I would recommend under the care of a qualified professional, is to actually bind or to follow some kind of chelating procedure. So we can use different oral chelation products, or you can do actually IV chelation. There's some people that will do IV chelation to work with heavy metal toxicity. This is something that needs a bit more guidance, but part of this is at least knowing your options. So a first step for this is that I'm now offering a class every month called Dental Detox, which we do, one Thursday night a month to just educate people on the different options that they have to be able to detoxify from some of the dental procedures, specifically the amalgam removal. So if you're interested in learning some of these basic detoxification strategies, I invite you to come to one of the classes and learn more about that. You'll learn simple strategies that you can apply right now and other strategies that you may want to consider to find somebody that can help you with that. So a very important aspect of going beyond just the amalgam removal, but to actually improve your body's ability to detoxify. Very important. Thank you.